Let's talk about signs of autism in your baby or toddler. My name is Sophie Pickles and I am an infant and child development specialist. I have worked with many families along the journey to finding out that their child is autistic, and while I am not qualified to diagnose autism myself, I do have lots of tips of things that I have been able to spot and patterns that I have been able to see in young children as I have been working with them, and also in my close family. Now, of course, all babies are different, and that goes without saying. We do know this. So a lot of these things that I'm talking about may not apply to your child, only some of them may. Even if all of these things apply to your child, it doesn't mean that they are autistic, but it is something that should raise that little idea in your mind that maybe you should go and get things checked out. So where do you need to go? Well, to the health visitor, if you have one, if you're still in touch with one, or to a GP, and they will be able to put you in the system and refer you to the correct people. If you don't have a health visitor for your toddler, for example, if they are over the 2-year mark, but you have a young baby, then when you see the health visitor for that younger baby, mention the older child as well. Or you can just ring your health visiting team. Their number will be accessible to you either through your GP, or you'll find it in their red book, and we're talking about obviously children in England specifically here. I will also say that occupational therapists don't get enough recognition for the amazing work they do. Often our children are not referred directly to occupational therapists, yet these are the people that can really help our children and don't always have this lengthy waiting process to be seen with. So it's really worth having a look in your area to see if there are any either NHS occupational therapists or private occupational therapists. I know a fantastic online occupational therapist, and I will link her details down below for you. She's on Instagram and she does virtual calls all over the world. She's actually based in South Africa, but she worked in the UK, in England, for the NHS for many years. So with that being said, let's get into some of the symptoms that you might notice if your baby is possibly on the autistic spectrum. Number 1, you may find that your baby does not respond to their name when they are called. They may just completely ignore you or seem like they're ignoring you, and they may not turn to look at you to acknowledge that they're being spoken to. One of the things that we always tell parents, the first thing that they need to do if they recognise this symptom, is to go and get their child's ears tested, because even though our babies have a hearing test at birth, sometimes things aren't picked up on, or of course things can develop over the years. So it's really important to go and get your baby's ears tested, their hearing tested, to rule that out as a possibility before we kind of look into anything further. That can also be the case with things like speech delay, dyslexia, or all of those kind of things too. Similarly, along those social routes, if your baby isn't smiling at you or laughing, then you may want to think about that too, because around the 6-week mark is when your baby will start to smile for the first time, and then around about that 10 to 12-week mark is when you'll see them laugh for the first time. Sometimes babies and children that are autistic will smile and laugh at things that are outside of the kind of social element. So they may smile at something that they find amusing or laugh at something that they find funny, but we're really looking for social connection. Are they smiling at people? Are they engaging with people and laughing at others? The same thing with eye contact. Are they looking at you when they talk, or are they averting their eyes? This can actually be a really, really tricky one to spot, because sometimes it looks like somebody is looking at you, whereas actually they're probably not quite looking in your eyes. They may be looking here, they may be looking here. And that is a way that autistic people cope, because they find eye contact very uncomfortable. So they may look at other parts of your face, or they may not look at your face altogether. They may just carry on looking at what they're doing. That doesn't mean that they're not listening to you or paying attention. It just means that they find looking into your eyes a little bit intense and unnerving. And to be perfectly honest, I'm not the biggest fan of making intense eye contact with people either. Sometimes I can find it a bit awkward. If you notice that your baby or toddler has a lot of repetitive movements, then note them down and you can speak to your GP and health visitor when you go to see them. So repetitive movements may be things like flapping their arms, rocking back and forth, banging or tapping on different parts of their bodies, banging heads, pulling hair. So any kind of repetitive movements, things that they do over and over again. This can often be associated with moments when they are excited and maybe overwhelmed, or potentially moments when they're upset as well. It's known as stimming, and it's something really common that many neurodiverse people do. And again, it's just a way of that person, that baby or child in this case, helping their body to regulate their emotions. If those repetitive movements turn into maybe physical things that are hurting your child, and if they're hurting themselves, they might be hitting themselves, even biting or pinching, then that's obviously something to be concerned about, because we don't want them hurting themselves. And that can be a sign that something else is going on to cause them to want to hurt themselves in that way. And again, it's often found at times when the baby or child is distressed at the outside situation, often to do with them being in sensory overload. So too much is going on for them to cope with, and that's how they are regulating their emotions. But obviously we don't want them to do it in a way that means that they're hurting themselves. You may find that your baby or toddler is very sensitive to lots of things in the outside world. This can often be called something called sensory processing disorder, and it's generally not something that we would see or diagnose, or professionals would see or diagnose, until the child is a little bit older. And that's because a lot of little ones struggle with sensory elements of life. However, if it's to the extreme, so your baby or child is getting very easily distressed or upset by the things that I'm about to mention, then it is worth speaking to somebody about. And those things are lights. Sounds is a very common one, so either shrill sounds, loud sounds, things like a dog barking, a car horn, a hand dryer in the toilet, that's a very common one, the smoke alarm going off in your house. It can even be something as simple as the washing machine, as well as things that are giving them a sensory processing problem with touch. So if clothes are not quite fitting right, if they're too tight around their wrists, if their socks are not on properly and they're slightly twisted, that can feel incredibly uncomfortable and actually almost painful to that child. So it's really worth not only making sure that you appease their needs and finding clothes that they do find comfortable to wear, but noting it in the back of your mind that maybe this is a sign that something else is going on if it links with a lot of other things as well. The last thing I'm going to mention, and I left it for last because it's a difficult one to kind of put a pin in, is lack of communication or talking. Now, really, in a perfect world, by the age of, I would say, probably about 15 to 16 months, we would see babies saying some words. But not all babies will reach that milestone at that time. Yes, some will reach it much sooner than that, but some won't. Some might not say their first words until much closer to their second birthday, and that doesn't always mean that there's a problem. However, like I said before, it is just something to bear in mind and just to mention to a health visitor or a GP so that they can have it on file. If your child is struggling with their communication, if they have very, very few words, if they're using sounds or gestures to talk to you rather than words by the time they reach their second birthday, then that may be a sign that they're having trouble with their communication. And it can be for many reasons. Hearing is one of them, like I mentioned at the start of this video. In the UK, your child will have, or certainly in England, your child will have a 2-year check. So they will go through all of these things with you when your child reaches around their second birthday. It's normally a few months after they turn 2. If you have any questions relating to anything that I've talked about, or speech, because again, I know that's something that lots of you do have questions about often, then leave them in the comments below and I will respond to you. Or you can find me on Instagram or Facebook and send me a private message. Unfortunately, YouTube doesn't have that function. If you like this video and you want more developmental videos to do with babies and toddlers, then you're in the right place. So go on down there and subscribe and turn on the notifications bell so you can see all of my new videos. Thank you very much for watching this one, everyone, and I will see you all soon. Bye.